Hi, I am Dr. Natesh, Senior Consultant Orthopedic Surgeon and Professor of Orthopedics. And I am talking about, so many patients have this doubt that like in kidney transplantation or liver transplantation, where in kidney transplantation they take the complete kidney of a donor and place it inside. In knee replacement surgery, whether the entire knee joint is replaced or so. Actually, knee replacement is a misnomer, because when Scott and Insall they have started, they were replacing the entire condyle, but eventually over the generations, initially when knee replacement has been started, they were replacing the entire condyle of the femur, and so the name has been derived from that scenario. But recently, with the recent advances, recent changes in the scientific data, what is being done is only the articulating surfaces they are being replaced, and I can show you on a model how the knee replacement will be done. So once you see for example, if you see, this is your knee joint model, this is the thigh bone and this is the leg bone, tibia, and this is the femur, and this is your kneecap. So a small incision will be made here, and this patella will be moved aside, and then these surfaces will be dislocated and they will be cut in a particular shape, and then new implants will be placed like this. So the arthritic surfaces will be cut in this particular shape. You can see this shape. This shape allows the particular implant to sit inside, and that is implant specific. And once this femur bone, thigh bone is cut in this particular shape, we wash it, we put a cement on this, and we take appropriate sized implant that is there with us, and then we place this implant here with cement, and then we place this, we cut the tibia surface into a flat perpendicular to the ground, parallel to the ground, and then we clean it and we put bone cement, and then this is the tibial component, and tibial component is placed inside. And then after reducing this, because these two are metal surfaces, they can't articulate with each other and move against each other without any erosion. So what we do is we put a plastic highly cross-linked polyethylene material, and this is placed inside the tibia, and the knee is reduced now. Now whenever the patient is walking, he will be walking on this knee, so the patient will not be having any pain. So this is how a knee replacement is performed. Of course, this is Opulent Max knee. Almost other knees, other companies, any company's knee basically will be the same. Regarding the pain during knee replacement surgery, of course during knee replacement surgery the patient will be under anesthesia and there won't be any pain. And after surgery definitely there will be some amount of pain which can be handled very effectively, and patient can be comforted with the nerve blocks. Especially with recent advances in anesthesia, patient can be almost be painless for first 24 to 48 hours, and then some centers they advocate repeating the nerve blocks and all. Some centers they just depending upon the patient's capacity to take pain. If it usually on 0 to 10 scale, a pain of around 4-5 will be there after 48 hours, and then that will also come down gradually. Or else if the pain is severe, for some patients they can be very sensitive to pain. Such patients we can give once again a nerve block or some other modes of anesthesia, and we can handle the pain. Nowadays with recent advances in anesthesia and surgical techniques and minimally invasive surgery and minimally invasive equipment, surgical equipment, the incidence of pain, incision size, everything can be reduced quite significantly. Depending on the number of sports injuries, yes, there are as many number of sports injuries as there are ligaments in our knee joint. Knee joint is a complex joint with lot of ligaments for stabilization, and there can be injury in any part of the knee joint, including the meniscus, anterior, posterior, lateral, medial ligaments, or patellofemoral ligaments, medial side, lateral side. So depending on the type of injury that patient suffered, there can be any damage to the ligament.